I've had the opportunity to get to know and work with Dr. McDermott over the last several years. First as him being a member of the board of directors, then our secretary-treasurer, then our vice chair, and most critically as chairman during one of the most trying times that this association, the state, and the country has faced.
He very much embodies the mission of our organization to improve the health status of all of the people in the communities that we serve. He wants to make sure that we are well informed as a healthcare provider of the needs of the community, and therefore he conducted virtual town hall meetings, being the first one in our community to do such. And as a result, he became the content expert and one that has been consulted by many different organizations in the community relative to the pandemic.
You're going to hear a lot of people talk about the talents that Mike has, and they are many. But one that's probably a little less common is the way that Mike is able to take complex and intricate programs, policies, models, and he's able to digest those things and turn them into something meaningful and then communicate those effectively to vast and different audiences. He does this every day here. One particular example is what he's done in our accountable care organization. So the Mary Washington Health Alliance was actually here when Mike became CEO, but he very quickly showed a real penchant for diving into these models that CMS and CMMI send us and understanding the implications for not only Mary Washington Healthcare, but for providing healthcare more efficiently throughout the entire community. And he understands that, and he provides direction for the Alliance to implement these vast and different accountable care programs, and we have success at them. And I think some of that is due to Mike's ability to really understand them at their core level. It's really phenomenal.
One of the things that I think Mike does exceptionally well is his passion and drive for protecting our community. During the midst of COVID, as COVID was starting, we actually brought up a field hospital to provide extra resources as we cared for COVID patients that were going to be hospitalized.
He led efforts to get Virginia ready. He worked diligently to prepare for as well as to respond. During those panicky days at the beginning, when everything from PPE to other resources to tracking this horrible virus were all starting up. And each and every day, Dr. McDermott not only led his hospital and his health system, but led the efforts at VHHA and all the health systems across the Commonwealth. He continues to lead now on vaccination efforts, and he continues to help focus all of our communities on how do we deal with combating this virus, and then getting back to what I'm going to call the new normal, and the needs and addressing the needs of Virginians in the Fredericksburg area and across the Commonwealth.
Mike is very concerned about health inequities. Therefore, it's not surprising that he wants to make sure that the vaccinations that we administered in our community were done in a fair manner. As a result, the vaccination rates for underserved populations in our communities often mirrored their representative share of the population. Mike's visibility in this community has been enhanced during the pandemic. It's not surprising, therefore, that even members of underrepresented populations that are served have shown up at our clinic saying, I don't want the Pfizer vaccine, I want the McDermott vaccine. That's branding, that's Mike McDermott.
It's provided hope for our associates. I had a leader who was working with me in the clinic last week who said, I've been in the midst of COVID all year, and working in this clinic has given me hope for what's coming. And that's what Mike has done. He's created hope when there wasn't a lot of hope, and made us and challenged us to be better than who we are. And that's why he's so deserving of this award.
I can tell you without a doubt that Dr. McDermott was the right man at the right time. I want to thank you again, Dr. McDermott, for everything you've done, and say congratulations.
From all of us here at Mary Washington Healthcare,
congratulations, Mike.